My name is Sarah Sherman. I am a physical therapist and athletic trainer at the University of Toledo.
And why are you concerned about the long-term wellness of our athletes, especially when it comes to osteoarthritis and chronic pain?
So even though I'm a young clinician, I've had the opportunity to work with patients across the lifespan, and that's really afforded me the opportunity to experience long-term health and wellness in a short period of time. So I think that I have really changed my perspectives on how I approach patient care based on reflecting upon those interactions. So earlier in my career, I think that I based success on returning a patient to play. So if they had an injury, that was really all I was focused on, was were they able to get back to play successfully, because I think that's what I thought was most important to them. But then as I started realizing that I was also seeing that same patient just 20 years down the road, they were the patient that had an ACL reconstruction, had returned to play successfully, and then now they're back in physical therapy because they have chronic pain or limited functional mobility. And I started to realize that maybe there's more to what we're doing than just getting someone back to play successfully. So from that, I started realizing that it's really important to treat the patient as a whole, and recovery is multifactorial. And I think that's what I'm most concerned about, is that most of us don't approach recovery in a multifactorial way, and we focus just on one aspect of it. So really we should be talking to our patients about nutrition. How can they incorporate nutrition not only into their recovery, but how can they implement those diet changes for long-term health and wellness for the rest of their life. We should be teaching them not just the best rehab exercises for their injury, but how do they exercise successfully to maintain proper joint health 20 years from now. Even things like sleep are really important and probably aren't focused on enough in their recovery, and even just them being student athletes, and those are really important for overall long-term health and wellness.
What tips do you have for a young professional?
I think the best advice I can give is to communicate. That means communicate with our patients. So we as healthcare professionals have a responsibility to educate our patients about all those things that I just talked about. They don't know what's best for them, they don't know the future, and they are only focused on returning to sport or returning to the immediate activity. So it's our role to educate them about long-term wellness and what they can do to help set themselves up for success. I think it's also important that we communicate with other healthcare professionals and collaborate with each other. So this is where I believe that collaboration with clinicians and researchers can really go a long way in our field and help both research and clinically determine what are the best things that we can do for our patients, how can we set them up for success and prevent some of that long-term sequelae, so that that injury when they're in high school or college isn't setting them up for failure 20 years down the road.
Thank you.